Close-Up is brought to you by the Kia Sorento R, redefining the power of Kia.
How does this sound? A free health clinic where young people can walk in off the street and there's no time limit on the appointment. Too good to be true? Well, that's the way it works at Waves, a youth health service in New Plymouth. Waves has 3,000 young people on its books. It's helping some of the kids at the fringes of our society, keeping them healthy and off the streets. But that good work comes at a cost that the local health board won't stump up for. Jahan Casanada has the story.
My history is that of sexual abuse, domestic violence, alcohol and drug addiction, and severe depression.
I'm a solo mum to an 18-month-old boy.
I've had a pretty rough life. I've been to jail 3 times.
Life has been tough for me. I've been in a lot of trouble.
I've got 26 assault charges and I'm not proud of it at all.
I struggle with asthma and eczema most of my life.
For so long, all I wanted to do was die, and after numerous attempts at that, realising that I wanted to live life rather than just exist. And that's what a lot of the youth here do, they just exist.
Growing up can be tough.
In every community there are kids crying out for help.
Good morning, Waves. Sarah speaking.
Waves is a one-stop shop, a youth health clinic, counselling service, development centre and a good old hangout. For politicians, it's not a bad place for a photo op.
Waves rocks!
But will those politicians step in now that Waves is in trouble?
Hello, Colin. Hi. Come through. Okay.
Waves is the brainchild of Taranaki woman Louise Roebuck.
I was working as a public health nurse, and I was working in most of our high schools in New Plymouth, and I was seeing a huge unmet need in health issues for young people.
If you're a teenager suffering with alcohol and drug addictions, or you're fighting to be comfortable with your own sexuality, or the boy who you'd always chased ended up giving you an STD and you couldn't go to your mum.
Often their parents said, I don't have money to go to a GP. So often I was putting my hand in my own pocket to pay for prescriptions, taking them to the doctors myself.
She decided to start her own youth clinic, a place where young people feel safe and don't have to wait days for an appointment.
People walking off the street, we don't turn anyone away. Sometimes they might come in with 5 or 6 or more things, but we deal with the most important first.
Unlike a visit to a regular GP, these appointments don't have a time limit and they focus on the big picture.
So you're looking at who they're living with, any family violence, are they in school or education, what are they doing for fun, any drugs or alcohol, their diet, sexual health and their mood.
And the cost to the patient, zilch.
Doctors are like $50, $60 and there's a lot of people, a lot of young people that just can't afford that.
And coming here, it's free, you get everything you need.
Waves has more than 3,000 youth on its books and it's become the centre of Taranaki's youth community.
When you wanna go somewhere, you better wake up and pay attention.
Lani was living under a bridge when he was approached by a member of Waves.
And he goes, oh brother, where do you live? And I go, you're standing on it. He goes, no way, you're not living here. You want to come home? I'm taking you home with me. And I was like, are you sure?
2 years on, Lani has been working for Waves, helping the kids he used to hang out with.
I've drunk with these kids. I've smoked with these kids. So they've seen me in the darkest hours, in the darkest times. But now I'm doing something right for them, you know. I gave up the drugs, I gave up the alcohol, and I'm, you know, helping them complete their court sentences, making sure they stay out of jail.
Tegan is one of them.
Because I used to be in the cells like every week. The people that I was hanging out with were older than me. Like, I'm 14 now and I was hanging out with like 18, 19-year-olds. It started getting to the point where I just started losing my education, and like even now I can't read and write properly. I can write, but I can't read and spell properly.
But he's been mentored by Lani and he credits Waves with keeping him out of jail.
I want to put it behind me and just keep thinking positive and just keep stepping forward, because if you think about it, what way do your feet point? They point forward, so you keep walking forward, they don't point backwards.
Waves Health Clinic costs $35,000 a month to run. It's relied heavily on sponsorship from trusts and businesses. But that's no longer enough, so it's closing.
I was devastated.
I was really angry. I was mostly disappointed.
I was gutted, absolutely gutted.
Who wouldn't want to fund this place?
Heaps of youth are just going to be like in and out of trouble because coming here, they honestly do stay out of trouble.
Without having a place like Waves, we won't be able to help these kids. Those kids that don't go to school, that don't go to course, that are kicked out of every single course in this town, and we give them opportunities.
Many politicians have visited Waves and sung its praises. Aside from the PM, Social Development Minister Paula Bennett and Associate Health Minister Tariana Turia, who described the service as legendary. And yet the health clinic does not receive government funding. It's survived so far because of the dedication of a handful of staff, many volunteers, and the woman they call Mama Lou.
She's my rock. If it wasn't for her, I think I'd still be in jail.
They showed us love. Now we can show other people love.
It saved my life, it saved my partner's life, and it saved many of our close friends' lives.
But while Waves has saved lives, it now needs a lifeline of its own.
Waves is one of 12 youth one-stop shops around the country. Now, some receive government funding, but others have been forced to close. So what can be done to save Waves? Earlier, I asked Sandra Boardman, she's the General Manager of Planning, Funding and Population Health for the Taranaki DHB, if she thought Waves was doing a good job.
Waves does an excellent job of bringing youth together and doing a whole raft of youth development services, and the DHB acknowledges the position that it has within Taranaki and within New Plymouth.
Acknowledges that, but happy to see it wither on the vine.
Well, the DHB hasn't funded Waves directly for health services ever. And the important thing with regard to health providers is that they're big enough that they're able to provide professional development and have enough staff to give them time off for training and development. And to do that, you need to be fairly large. And an organisation that provides a range of services outside health that Waves does is never going to be big enough to do that. So that's why we've always encouraged Waves to work in partnership with other bigger health providers who can do that.
I would have thought the most important thing in providing services to youth is that they actually work and the youth actually want to engage with them. Have we got a situation here where the youth want to engage with Waves more than they do with any of the primary health organisations they've signed up to?
Well, we have a comprehensive range of youth health services in Taranaki, and youth use all of those. If, for example, if you look at sexual health services, we recently asked young people in this area where they would go for sexual health advice. And although 30% of those young people said they would go to Waves, another third of them said they would go to their GP, and a further third said they would go to sexual health services.
But if 30% of the people you surveyed say they're looking to Waves for those services, don't you need to work out how you can help that? John Key gave it the thumbs up, or was that just election year posturing?
We've been working with Waves since the time that the last organisation exited that contract. We've been encouraging them to partner other organisations since that time, and they haven't managed to find a partner that they're able to do that with. There have been a number of offers on the table, and my understanding is they're still investigating them.
Can you understand the frustration? The people we spoke to said they don't want to talk to their GP about sexual health and sexual matters. They trust the people at Wave. It works. A lot of them go there. Doesn't the system need to fit around that instead of trying to squeeze them to fit around the system?
In the future, what we're hoping is that other health providers will deliver services on that site. The venue is one that youth feel comfortable in, and that's why, you know, the young people that use the service go there. So what we want to happen is for other providers of health services to deliver services on that site.
But isn't Waves a provider as it is? Isn't the service they provide, which may be lesser than a primary health organisation, a valuable one which the youth trust?
It is, but it's not the only service that Youth Trust, and we're trying to provide a comprehensive range of services for all young people in Taranaki. 78% of young people in Taranaki are registered with our oral health service, which is higher than any other DHB in the country. And as I've said, 98% of them are registered with a GP. There are providers already willing to go into partnership with Waves. It is really about the Waves board having the discussions and deciding which of those providers most closely fits with their view as to where they see health services fitting into all of the services that are delivered out of the Waves site. Because remember, it provides youth development, it provides employment opportunities, housing advice, benefits advice. There's a whole range of services delivered out there, and the Waves board will no doubt want a provider that actually fits in with how they see services being delivered. But there are already offers on the table, so it's not a matter of not finding a provider, it's a matter of finding the provider that most closely fits with how they see things happening at Waves.
There we are. So what about John Key giving Waves the thumbs up and the other ministers who seem to endorse it? We wanted their response to its closure. Both John Key's office and Paula Bennett's referred us to a statement from Peter Dunn in the House today that Waves closure wasn't a funding issue. And that's pretty much about all we got. So, do you think a facility like Waves should get the support it needs? We'd like to hear your views. Go to our website or email us at closeup@tvnz.co.nz. And of course, we're on Facebook too. Join us there for any comment.